Switching gears, markets are also paying careful attention to rising COVID-19 infections in many parts of the world. Yahoo Finance senior healthcare reporter Anjalee Khemlani has been tracking the latest. Anjalee.
That's right, Brian. So what we're hearing is actually a lot of cases rising. We know in China, for example, but also around the globe in parts of Europe as well. It's what prompted the World Health Organization to say that this is just the tip of the iceberg as we put our attention on that BA.2 variant known as stealth Omicron. The Director General specifically saying that with reduced testing across the globe because of that decline in cases, that's what's leading to that thought process of this is just the tip. Director General also saying that there are, quote, unacceptably high levels of COVID-19 mortality in many countries, especially where vaccine levels are low among susceptible populations. In particular, China is there, as well as over here in the U.S. It's why we also saw Pfizer, for example, go out for a fourth dose filing for those 65 and older. We also know that there has been a reduction of testing broadly, even though we have at-home tests available, but that doesn't necessarily feed into the public tracking of that. So that's where there are some concerns and have been for some time. We also know CDC Dr. Rochelle Walensky today saying to the Bipartisan Policy Center that the agency is working on better tracking of cases and hospitalization. To that effect, we know that the wastewater surveillance that has been come under the CDC as part of their tracking has noted higher prevalence of COVID-19 cases here in the U.S.
And also in terms of the U.S. approach to COVID, there is a change in leadership. There is a new COVID czar who is a former dean at Brown University, or I guess he's not former yet. Maybe he's taking a leave to go and do this, who we've spoken to on the program, Ashish Jha. Talk to us about what this symbolizes about this phase of the pandemic.
Absolutely. So Dr. Ashish Jha is, as you noted, the Dean of Public Health at Brown University, previously at Harvard, has definitely made his presence on Yahoo Finance as well as other networks. And that's sort of where the prominence is of this appointment. He will be taking a brief leave about a year from Brown in order to accept this position at the White House. But what we're looking at is a shift in how the White House is addressing this public health emergency with someone who's an academic and someone who's a public health expert like Dr. Jha. It really is focused on his ability to really address complex issues and parse through them in ways that people understand. We've heard him not just on air, but also on Twitter, where he uses that platform really well to provide messaging. Today, in the announcement of his appointment, tweeting out a quote, "We are not done. We are very likely to see more surges of infections. We may see more variants. We can't predict everything with certainty, but we have to prepare to protect the American people, whatever Mother Nature throws at us." And that is really sort of that cautious approach to what we know is an ongoing pandemic as the U.S. really prepares for the potential of yet another wave, as we're seeing happen around the globe. So it's going to be, really interesting to see how he shifts the messaging and the focus from outgoing coordinator Jeff Zients.
Anjalee Khemlani, thanks so much.